Greetings, everyone, and thank you for joining the Office of Infectious Disease and HIV/AIDS Policy, or OIDP, which sits within the Office of the Assistant Secretary for Health at the U.S. Department of Health and Human Services. Our technical assistance webinar for the evaluation of linkage to care programs in support of hepatitis-C elimination. My name is Dr. Jessica Deeren, and I am the Viral Hepatitis Policy Advisor with OIDP. I am joined today by Mr. Dwayne Barlow, Grants Branch Chief with the OASH Grants and Acquisitions Management Division, or GAM. Today, we'll be providing an overview of the Notice of Funding Opportunity, or NOFO, and the competitive application requirements. A few housekeeping items before we begin. All participants have been muted. We invite you to submit questions throughout the webinar in the Q&A window on the right side of your screen. Please ensure that you select the option to send your question to all panelists. We will not be addressing questions live during this webinar, but will collect and address questions in a frequently asked questions document, which will be posted to grants.gov. This TA webinar is being recorded and will be posted for the duration of the competition on grants.gov, on HHS's YouTube channel, and on OIDP's viral hepatitis webpage. Next slide. Here is today's agenda. I will cover a programmatic overview of the Notice of Funding Opportunity. Dwayne will cover the competitive application requirements. And finally, we will provide time at the end of the webinar for additional submission of questions. But again, we encourage questions in the chat throughout the duration of the webinar. Next slide. Please be informed that the Notice of Funding Opportunity is available to provide you with essential information and guidance regarding applications. It is highly recommended that you read the entire funding announcement and follow the NOFO carefully. Please note that the information provided in this call does not supersede any of the content of the NOFO. The NOFO is the written document that will govern the competition. And we strongly encourage you to subscribe to the NOFO on grants.gov to ensure that if there are any revisions made to it, you will receive notice. Next slide. On pages 1 and 2 of the NOFO, you will find the executive summary. For those of you not familiar with OIDP, the mission of OIDP is to provide strategic leadership and management while encouraging collaboration, coordination, and innovation among federal agencies and stakeholders to reduce the burden of infectious diseases. OIDP coordinated the development of the Viral Hepatitis National Strategic Plan, which was released in 2021 and has a goal of viral hepatitis elimination by 2030. OIDP also works to promote best practices that improve health outcomes for people disproportionately impacted by viral hepatitis by reducing health disparities and addressing social determinants of health. Next slide. Here's some background. Up to 2.4 million people are estimated to be living with hepatitis C, and the number of new infections has more than doubled since 2013. To reach elimination, the Viral Hepatitis National Strategic Plan supports the need to integrate hepatitis C services in high-impact settings or settings where people disproportionately impacted by hepatitis C may touch the healthcare system. High-impact settings may include correctional facilities, substance use treatment programs, syringe service programs, and other harm reduction programs. Next slide. Programs that provide linkage to care services, such as patient navigation, can be an effective strategy to improve patient outcomes when fully integrated care or provision of hepatitis C treatment in the high-risk setting cannot be achieved. So there's a need to assess the effectiveness of novel linkage to care strategies in populations disproportionately impacted by hepatitis C to identify barriers and facilitators and further support sustained investment in linkage to care strategies. Next slide. The purpose of this OIDP project is to implement and rigorously evaluate novel hepatitis C linkage to care services in settings with high prevalence of hepatitis C. Next slide. I will now review each of the expectations for funded projects. The first component of the expectation is to develop partnerships to implement novel linkage to care services. Recipients should develop partnerships with at least 2 community and/or governmental organizations that serve populations disproportionately impacted by hepatitis C in high impact settings. We strongly encourage recipients to partner with correctional facilities, encourage recipients to involve at least 1 partner that serves and/or is located in a rural setting, and encourage recipients to seek and include the meaningful involvement of communities, including state and our local health departments, local government agencies and/or businesses, and community-based organizations in the development and implementation of the research, as well as in the translation and dissemination of results. Next slide. Recipients must conduct both a process and outcomes evaluation. The process evaluation should describe facilitators and barriers to implementation, the extent to which the program was implemented as designed without redundancy, and whether the program was accessible and acceptable to the population served. Next slide. The outcome evaluation should examine the effectiveness of the linkage to care strategies on key health outcomes. Recipients should evaluate both short-term and long-term health outcomes and may include secondary outcomes as appropriate. Potential key short-term and long-term health outcomes and secondary outcomes are listed here. Recipients are also encouraged to conduct additional analyses such as an economic evaluation. Recipients should have access to and use appropriate data sources of sufficient quantity and quality to meet the project goals within 3 years. And where applicable, recipients should identify additional data sources to address any gaps identified in those originally proposed. Next slide. Additional expectations are listed here. Recipients should disseminate promising practices through publications and presentations, and identify practices that may be generalized outside the study and translated into practice. Recipients must also create a disparity impact statement that uses local data to identify the populations most at risk for health disparities relative to this initiative. Next slide. The award information is found in section B2, page 9. The estimated federal funds available for this cooperative agreement is $440,000. We anticipate awarding 1 award for $440,000 per budget period. The budget period length is 12 months with an estimated start date of September 15th of this year. And the estimated period of performance is not to exceed 3 years. Next slide. Now we are going to transition to the application content, which is found on pages 13 to 15 in the NOFO. Next slide. To ensure a comprehensive project narrative, we suggest including these components, and we will go into detail on each section. Next slide. The first component is the statement of need, where you will need to describe the scope of the problem that will be addressed by the proposed project. You should include a description of the current gaps, barriers, and facilitators in hepatitis C linkage to care strategies in the population or setting that will be evaluated. Include how your proposed project will build upon or expand prior research or otherwise contribute to the field. Avoid providing a broad or sweeping historical overview that is not directly related to the proposed intervention and activities that will be implemented and evaluated. Next slide. The next component is the proposed partnerships and interventions. Describe the hepatitis-C navigation or linkage to care program, population and or setting that you are proposing to partner with, and the novel intervention you plan to implement and evaluate. Please describe the partner organization, how they were identified, and how they will be meaningfully engaged in the project. Provide data-driven rationale of how the high-impact settings were selected. For the proposed intervention, please provide a clear and concise description of the linkage to care intervention, description of specific activities, and how it addresses the need you identified in your statement of need. Explain the rationale for using a particular intervention and present a clear connection between the gaps and needs and activities. Clearly describe the roles and responsibilities of each partnering entity. This includes demonstration of your access to planned data sources and study populations. The roles and responsibilities for each partner should be substantiated with a signed data sharing agreement, memorandum of agreement, or letter of commitment that describes the partner's commitment of resources, time, and personnel. Next slide. Next slide. The third component of the project narrative is the evaluation approach and outcomes found in section D3, pages 15 to 16. Describe your evaluation plan for both a process and outcome analysis to assess the impact of the intervention. Include the methods you will use to evaluate whether the proposed intervention was implemented as planned and achieves its measurable outcomes. The process evaluation should describe facilitators and barriers to implementation, the extent to which the program was implemented as designed, and whether the program was accessible and acceptable to the population of focus. The outcome evaluation should examine the effectiveness of the intervention on key health outcomes. An economic evaluation is also encouraged to provide cost benefit of the intervention. Next slide. We will not fund any project that does not include measurable outcomes. So you should clearly identify the measurable outcomes that will result from your project, describe how you will measure and report on the outcomes, describe the quantitative and qualitative tools and techniques you will employ to measure the outcome, and how you will identify and document lessons learned. Please describe your data management plan, including available data sources and feasibility of collecting appropriate process and outcomes measures. The DMP should include a description of the protection of privacy, confidentiality, security, and intellectual property or other rights. Next slide. The fourth component of the narrative should describe the method you will use to disseminate the project's results and findings in a timely manner. You should also propose other innovative approaches to sharing results with audiences who might be interested in using the results of your project to inform practice, service delivery, program development, and or policy making, especially to those who would be interested in replicating the project. Next slide. Finally, the fifth component of the project narrative is a description of your organization's capability to successfully implement and evaluate the proposed project. You should describe your organization's readiness to begin implementation and evaluation of the intervention within the first 3 to 6 months of the project. You should describe any current or previous relevant experience of your organization. You should clearly delineate the roles and responsibilities of project staff and sub-recipients, and identify the key personnel for the project. Key personnel should include at minimum the project director, principal investigator, and lead evaluator. We expect that throughout the award period, the PDPI will have involvement in and substantial knowledge about all aspects of the project. Also, please include information about any contractual and or supportive staff or organizations that will have a secondary role in implementing the project and achieving project results. Next slide. Now we will transition to the application review information. found on pages 29 to 31 of the NOFO. Next slide. Federal staff and an independent review panel will assess all eligible applications according to the following criteria. Next slide. The statement of needs section will be worth 5 points. The panel will evaluate this section based on description of the need to be addressed, the current gaps, and how the proposed project will build upon prior research. Next slide. The proposed intervention and partnership section will be worth 30 points. The application will be assessed based on the extent to which the applicant has provided rationale for how the settings were selected, including at least one in a rural area, description of the linkage to care intervention, how partners will participate in collecting or sharing data and implement quality improvement, and provide evidence to support the commitment of the partnership, such as with a memorandum of agreement or a letter of commitment. Next slide. The evaluation approach and outcome section will be worth 30 points. Applications will be assessed on a description of a clear process and outcome evaluation with measurable outcomes, demonstration of availability of data sources, including having a data sharing agreement where appropriate, and a description of how outcomes will be tracked, monitored, reported, and used for continuous program quality improvement. Next slide. The dissemination section will be worth 10 points, and the application will be assessed based on a description of the research dissemination plan and how the findings will reach the population served, the general public, and other parties who might be interested in the results of the project. Next slide. The organizational capacity section will be worth 20 points, and the application will be assessed on demonstrated capacity, experience, and expertise of the applicant to successfully implement and evaluate the intervention, demonstrated readiness to implement the project within 3 to 6 months, description of the key personnel and their experience working with high impact setting partners to improve hepatitis C linkage to care, and inclusion of a detailed work plan for the 3-year project period. Next slide. Finally, the budget section will be worth 5 points, and the application will be assessed based on the degree the proposed budget adequately supports proposed activities and describes how the total amount was determined, and the budget is detailed, reasonable, adequate, cost-efficient, and aligned with the proposed technical approach. Next slide. Now I will turn the presentation over to Dwayne to review the application requirements and process.
Good afternoon, everyone. Again, my name is Dwayne from the Grants and Acquisitions Management Division, and we're going to go over the application piece at this point. Next slide, please. So your application is due by 6 p.m. Eastern Time on August the 2nd, 2023. Your submission time will be determined by the date and time stamp provided by grants.gov when you complete your submission. You're strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. Keep in mind that grants.gov may take up to 48 hours to notify you of successful submission. If you fail to submit your application by the due date and time, we will not review it and it will receive no further consideration. Next slide, please. Federal agency substantial involvement. So these awards will be made as cooperative agreements. Cooperative agreement is a form of assistance that allows for substantial involvement by the program office. Substantial involvement is in addition to the usual monitoring and technical assistance provided under a grant. Next slide, please. Eligible applicants. So applicant eligibility for this NOFO. So any public or private, profit or nonprofit entity located in the state, which includes one of the 50 United States, the District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, the Commonwealth of Northern Mariana Islands, American Samoa, Guam, the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands is eligible to apply for an award under this announcement. Faith-based organizations and American Indian, Alaskan Native, Native American organizations that are public or private entities are eligible to apply. Public or private community-based organizations or CBOs are eligible to apply. Next slide, please. So here's an example or listing of eligible applicants. So you have state governments, county governments, city or township governments, special district governments, independent school districts, public and state controlled institutions of higher education, Native American tribal governments that are federally recognized, public housing authorities and Indian housing authorities, Native American tribal organizations other than federally recognized tribal governments, nonprofits having a 501c3 status with the IRS other than institutions of higher education, and not nonprofits without 501c3 status with the IRS other than institutions of higher education. Next slide, please. So cost sharing or matching. You are not required to provide cost sharing or matching in your proposed budget. If you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification. During the merit review of an application, cost sharing will only be considered in the overall review of the adequacy of the total proposed budget, federal and non-federal share, to support the project proposed. Applications, including voluntary cost sharing or matching that result in award, will include the cost sharing or matching commitment on the notice of award at the level proposed in the application. Any change in that commitment will require prior approval from the grants management officer. Next slide, please. The notice of funding opportunity announcement. So again, the notice of funding opportunity announcement provides information and guidance related to the applications. Please read the entire funding announcement. Follow the NOFO carefully and keep in mind, as we said earlier, that the information provided in the NOFO takes precedence over any conflicting information in other documents, including this presentation. Next slide, please. The address to request application package. So you can obtain an application package electronically by accessing grants.gov at the blue URL that you see on the screen. You can find it by searching the assistance listing. It's formerly known as the CFDA number found on page 2 of the NOFO. The assistance listing number is 93.343. Please be sure to subscribe to the announcement in grants.gov so you receive notification of any updates to the NOFO or supporting documents. Next slide, please. Application submission. So OASH requires that all applications be submitted electronically via grants.gov unless an exemption has been granted by the grants management officer. If you submit an application via any other electronic communication, it will not be accepted for review. Keep in mind again that grants.gov is a website portal. All funding opportunities and grant application packages are made available on www.grants.gov. An application will not be considered valid until all application components are entered in grants.gov and received by OASH Grants and Acquisitions Management Division according to the deadline specified in the dates section of the NOFO. You can contact grants.gov with any questions or concerns regarding the electronic application process. You can reach out to them via phone at 1-800-518-4726. Next slide, please. So your application must be submitted as 3 files. File 1 should include the entire project narrative. File 2 should include the entire budget narrative, including supporting documentation described in the budget narrative content section. File 3 should contain all documents in the appendices uploaded in the attachment section of your grants.gov application. Please note, required standard forms do not apply towards your page count limitation in the submission requirements as stated in the disqualification criteria. Next slide, please. So any files uploaded or attached to the grants.gov application must be in the following file formats. So you can use Microsoft Word, PowerPoint, Adobe PDF, or any of the following image formats. So you can use JPEG, GIF, TIFF, or BMP only. Microsoft Excel files will not be accepted, and OASH strongly recommends that electronic applications be uploaded as Adobe PDF. If you convert your PDF prior to submission, you may prevent any unintentional formatting that might occur with the submission of an editable document. You can check the page count of your PDF and/or print the file to ensure that the document does not exceed the page limit. Next slide, please. Please be complete and do not leave blanks on forms unless the information is clearly not applicable. The individual submitting the application forms must have the legal authority to act on behalf of your organization. Next slide, please. So, to ensure successful submission of your application, carefully follow the step-by-step instructions provided at the blue URL that you see here on the screen. These instructions are kept up to date and also provide links to frequently asked questions and other troubleshooting information. Next slide, please. So here are your application elements. As far as forms go, you have an application for federal assistance, so the SF-424. You have a budget for non-construction programs, or SF-424A. You have the disclosure of lobbying activities, or the SFLLL. And then you have the project abstract summary. All right. With regard to files, the project narrative, submit all your project narrative content as a single acceptable file. For the budget narrative, submit all your budget narrative content as a single acceptable file. With regard to appendices, submit all appendix content as a single acceptable file in the attachment section of your grants.gov application. Next slide, please. With regard to the project summary, you must complete the project's abstract summary form provided in the application package. The abstract will be used to provide reviewers with an overview of the application and will form the basis for the application summary in the grants management and program summary documents. If your project is funded, HHS will publish the abstract from your form on tags.hhs.gov and usspending.gov. The abstract may also appear on the program office website or other government websites, so do not include sensitive or proprietary information in your abstract. Next slide, please. Application format. So be sure to follow the project narrative format instructions in the NOFO. Your application will be disqualified if it does not conform to the format requirements. You must double space the project narrative pages. You must use 12-point font. You should use an easily readable typeface such as Times New Roman or Arial. You may single space tables or use alternate fonts, but you must ensure that the tables are easy to read. For appendices and budget narrative, you should use the same formatting specified for the project narrative. For appendix documents such as resumes, you may use an alternate format that's common to such documents. Next slide, please. The UEI number in the system for award management. Okay, so to register your organization, you'll need a unique identity identifier, or UEI. And on April 4th, 2022, the federal government completed its transition to the 12-digit UEI number as the required UEI for registration in SAM.gov. You can begin the registration process, including receiving your UEI at the blue URL that you see on the screen. An entity registration checklist is available at the second blue URLs that you see on the screen. You can register in SAM either as an entity applying for federal assistance awards only, or for all awards, and that would include procurement awards. Next slide, please. Okay, the system for award management. If you are registering a new entity in SAM.gov, you need to create a login.gov account if you don't already have one. The minimum time frame to complete an initial SAM registration online is 30 minutes. The time frame for an applicant's registration to become active is up to 10 days and may take longer depending on volume, or if the SAM system flags the information you provide for manual validation. The average time frame for dates in SAM.gov to appear in Grants.gov is up to 72 hours. So if you plan to apply for this funding opportunity or think you might apply, you should ensure that your organization's registration is active in SAM well before the application deadline and will be active through the competitive review period. Next slide, please. Your SAM registration must be renewed each year. If you are renewing your registration, your old SAM.gov username and password may not work anymore. So you'll need to create a login.gov account if you don't already have one. Next slide, please. So we strongly recommend that applicants check for an active registration in SAM well before the application deadline. If you're successful and you receive an award, you must maintain an active SAM registration with current information at all times during the active award. If you have not complied with the SAM registration requirements, OASH may determine that you're not qualified to receive an award and may use that determination as a basis for making an award to another applicant. Should you successfully compete and receive an award, all first-tier subaward recipients must have a UEI number at the time that you, the recipient, make a subaward. Next slide, please. Funding restrictions. So if you're successful and you receive the award, by accepting the award, you agree that the award and any activities thereunder are subject to all provisions in 45 CFR Part 75, currently in effect, or implemented during the period of award, other department regulations and policies in effect at the time of the award, and any applicable statutory provisions. Your costs must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with the regulations and current policy. So indirect costs may be included per 45 CFR.414. An applicant should indicate which method or rate is used for this application. Keep in mind that pre-award costs are not allowed, and the current salary limitation is $212,100, and that was made effective January 2023. Next slide, please. So budget narrative and forms. Keep in mind that these forms must be consistent with the requirements of the NOFO. Budgeted costs must reflect proposed activities. Budget line item descriptions and justification requirements are explained in the NOFO. Suggested table formats are also in the NOFO. And then we have information for a plan for oversight of federal award funds. Keep in mind that forms, budget narrative, and detailed justifications do not count toward page limit. Next slide, please. Budget narrative and forms tips for development. You must develop an itemized budget using Section B, Box 6 of the SF-424A for the first year of the proposed project. For awards with an anticipated period of performance of 1 year or less, this will be the budget request for the entire project. Provide a budget justification, which includes explanatory text and line item detail for the entire first year of the proposed budget. The budget narrative should describe how the categorical costs, for example, salary, equipment, supplies, consulting costs, are derived. Discuss the necessity, the reasonableness, and the allocation of the proposed costs. Next slide, please. For subsequent budget years in an anticipated multi-year project, provide a summary narrative and a line item budget for each year beyond the first. For categories or items that differ significantly from the first budget year, please provide a detailed justification explaining these changes. Do not include costs beyond the first budget period in Box 6 of the SF-424A or Box 18 of the SF-424. The amounts entered in these sections should only reflect the first budget period. Next slide, please. Indirect cost methods are described in 75 CFR 75.414. This category has one or two methods that you can select. You can only select one, and you must clearly identify that section in your submitted budget. If your organization currently has an indirect cost rate approved by the Department of Health and Human Services or other cognizant federal agency, you should enclose a copy of the current approved rate agreement in your budget narrative file. If an applicant has never received a negotiated indirect cost rate, that particular applicant can elect to charge a de minimis rate of 10% of the modified total direct cost, which may be used indefinitely. If chosen, this methodology must be used consistently for all federal awards until such time as the applicant chooses to negotiate for a rate. Next slide, please. Next slide, please. So if your proposed budget requests a rate that's less than allowed, your authorized representative must submit a signed acknowledgement the organization is accepting a lower rate than allowed. So if you want to obtain a negotiated indirect cost rate with the federal government, you can contact the U.S. Department of Health and Human Services Cost Allocation Services regional office that is applicable to your state. The CAS regional contact information is available at the URL that you see on the screen. Next slide, please. Application disqualification criteria. So if your application does not meet the following requirements, it will be disqualified and receive no further consideration. So your application has to be submitted electronically via grants.gov by the due date and time, unless an exemption was granted 2 business days prior to the deadline. Keep in mind that if you successfully submit multiple applications for the same project, we will only review the last application received by the deadline. HHS, OASH, and GAM has to deem your application eligible. You must complete the required forms in the application package. We talked about the SF-424, the SF-424A, the SF-LLL, and the project abstract summary. Your application must be submitted in the English language and must be in terms of US dollars. Next slide, please. Your project narrative must be double-spaced on the equivalent of 8.5 by 11 page size with 1-inch margins on all sides and font size not less than 12 points. Your project narrative must not exceed 30 pages, and the total application, including project narrative, must not exceed 60 pages. Next slide, please. Keep in mind that your federal funds requests, including indirect costs, should not exceed the maximum indicated in the award ceiling per budget period, and that's $444,000. Your federal funds requests, including indirect costs, must not be below the minimum indicated in the award floor, which is $200,000. If you've included voluntary cost sharing or matching, you must include in your budget narrative a non-federal sources justification. Your application must meet any application responsiveness criteria under Section C3 or other application responsiveness criteria. Next slide, please. And for this particular NOFO, there are no other application responsiveness criteria. Next slide, please. Applications that lack the required supporting documentation or submit additional appendix files will not be disqualified from competitive review. However, this may impact your application scoring under the evaluation criteria. So please be sure to follow submission instructions carefully. Next slide, please. So here's a quick review of the application review criteria that you heard about in the program section of our presentation. So you have the statement of need, which is worth 5 points, to propose intervention and partnerships, 30 points, evaluation approach and outcomes, 30, dissemination, 10 points, organizational capacity, 20, and then budget, 5. Next slide, please. Okay, application merit review. So eligible applications will be reviewed and assessed by a panel of independent reviewers with technical expertise in applicable fields according to the criteria listed in the NOFO. So the merit review process is formal and confidential. Federal staff are available to answer questions and to ensure that the process is consistent and fair, but do not participate in the discussion and assessment of applications. Then the applications are reviewed first by GAM for the GAM staff for administrative and business compliance, and then by OIDP program office staff for programmatic compliance. Next slide, please. So, funding decisions. So the director of the Office of Infectious Disease and HIV/AIDS Policy will make final award selections to be recommended to the grants management officer for risk analysis. So upon completion of risk analysis and concurrence of the grants management officer, HHS will then issue notices of award. Keep in mind that no award decision is final until a notice of award is issued. And also keep in mind that all award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Keep in mind that we're not obligated to make any federal award as a result of this announcement. Only the grants management officer or the GMO can bind the federal government to the expenditure of funds. If you receive communications to negotiate an award or request for additional or clarifying information, this does not mean that you will receive an award. It only means that your application is still under consideration. Again, all award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. So, funding process as it relates to the review of risk posed by an applicant. So HHS will evaluate each application in the fundable range for risk posed by the applicant before issuing an award in accordance with 45 CFR 75-205. Keep in mind that OASH will use a risk-based approach and may consider any items such as the following as stated in your NOFO. So we'll take a look at the applicant's financial stability, the quality of management systems, and the ability to meet management standards. We'll look at history of performance. We'll look at reports and findings from audits performed, and we'll pay attention to the applicant's ability to effectively implement statutory, regulatory, or any other requirements imposed on non-federal entities. Next slide, please. Your plan for oversight of federal awards. If your internal controls are available online, you may provide a link as a part of your plan in the budget narrative. We've also included some supplementary material in section I2, which contains questions applicants may find useful in considering their plan for oversight of federal funds. Next slide, please. So non-funded applications as a result of risk review. If we determine that your organization does not meet either or both of the minimum qualification standards as described in 45 CFR 75-205A2, and we do not make an award to you as a result, we must report that determination to FAPIS if certain conditions apply. Keep in mind that the information reported in FAPIS is available to other organizations to review when considering you for other awards. Next slide, please. So your notice of award. The notice of award at the end of competition notifies the successful applicants applicant of the selection, award amount, project, and budget periods. It includes any conditions on the award, in other words, requirements that must be met as a condition of receiving grant funds. And it will include the standard terms, reporting requirements, and contact information for OASH, GAM, and the program office. Next slide, please. Points of contact. Keep in mind that GAM, or the grants office, is the official contact for awardees throughout the award lifecycle. All official communication related to the award is between GAM and the successful applicant. Unsuccessful applicants will be notified by the program office via letter. Next slide, please. So here's a summary and some tips. So for your project narrative description, please be clear, complete, and concise in the project description. Follow and address exactly what is requested in the NOFO. Don't make the reviewers search for the required information. Generally, the easier the application is to review, the better the rating or score. Keep in mind that reviewers are not allowed to do external research or follow embedded links, things like that. Clearly identify the sections of the application and indicate which component is being addressed. Keep in mind that your project narrative must include all required information within the page limit. Don't use appendices to expand the page limit. Next slide, please. Project narrative description. Make sure that your goals and objections are SMARTY, that is specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. Activities presented in the work plan should relate directly to the proposed goals and objectives. The program work plan, evaluation plan, and budget should provide a complete picture of how the applicant will address the needs as well as address the purpose and expectations in the NOFO. Next slide, please. With regard to staffing, the staffing that you select for the project should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Please be complete in describing what staff will do, the expertise required, and the percent time they will be assigned to the project. Next slide, please. With regard to budget, your budget should include adequate funds to carry out the proposed work plan, evaluation plan, and administrative responsibilities of the project. The budget should be reasonable and relate directly to the goals and objectives of the project. Don't request more funds than are available as listed in the NOFO. This amount is inclusive of indirect costs. The operating budget should be complete and include federal and non-federal funds and projected program income, for example, from fees and third-party payers and other contributing funds. Next slide, please. Overall, in your application documents, please include full names, that's first, middle, and last, for your authorized official, your principal investigator / project director, and all essential personnel. Keep in mind that electronic submission is required. Please don't wait until the last minute to begin SAM registration or update your registration. Keep in mind that you don't want to wait until the last minute to begin your electronic submission because things can happen. Next slide, please. So if you have more questions beyond this presentation, you can reach out to a couple of people. So for program questions, you can reach out to Jessica here, and her email is listed on the screen as well as her telephone number. If you have any administrative or financial questions, you can reach out to me, and my email address and telephone number is also listed on this particular slide. So if you have questions about electronic submission requirements, or you need grants.gov applicant support, you can reach out and go directly to grants.gov, or you can email them on support@grants.gov. And you can, as we said in the previous slide, reach them by telephone, which will be 1-800-518-4726. At this point, we want to remind you that if you have any questions about or issues as it relates to grants.gov, please don't contact the OASH program or the grants office staff, because again, grants.gov is not managed by us. So the only thing we would do is reach out to grants.gov ourselves to be able to provide assistance. So again, you want to reach out to grants.gov. Next slide, please. That concludes the application portion. So right now I want to turn it back over to Jessica.
Thanks, Dwayne. So if you are in attendance today and have any questions, please use the chat to submit your questions. And I will now give everyone an opportunity to submit any questions. If you were not able to attend this webinar today and have questions, please email me or Dwayne at our email address, or you can contact us by phone as well. We will not be addressing any questions live during this webinar, but all questions submitted will be addressed in an FAQ document, which will be posted to grants.gov. So I'm not seeing any questions coming in. So next slide. These slides and the webinar recording will, in addition to the FAQ document, these slides will also be posted to grants.gov. The webinar recording will also be available on HHS's YouTube channel and posted to OIDP's hepatitis webpage. So this concludes today's webinar. Thank you for your interest in this funding opportunity, and best of luck in the application process. Thank you.